I'm Sten Vermund. I'm a pediatrician and infectious disease epidemiologist. I serve as the dean of the Yale School of Public Health here in New Haven, Connecticut. I've been in the healthcare field for 4 decades. Now you, as nursing home administrators, are going to be joining me in this public health battle against coronavirus. The reality is that nursing homes and other institutionalized settings are a challenging environment at a time of a global pandemic. We know that proximity can accelerate transmission. We saw that in Washington State near Seattle, and a devastating impact of the coronavirus on the nursing home residents in that somewhat crowded environment. So we're going to be working on social distancing. We're going to be working on trying to distribute our clients. Some of them may be able to go home to families. Some of them may be independent enough that they could be distributed into what are now empty hotel rooms. However, many of them will be in residence in the nursing home and are going to need care. We think that the CNA is a vital surge employee for you, that you'll be able to provide more individualized care to the clients. You'll be able to assist them in a time of great stress on the very few doctors and nurses that you may have available to you. And these individuals with fundamental nurse assistant training can help you at many different levels. One of those is education, reminding the elderly to keep social distance, helping them with hand hygiene, helping them with activities of daily living, having someone who knows about protecting themselves, the CNA having been trained in the use of personal protective equipment, gown, glove, mask, having that individual be able to work with someone who we think might be infected or having been exposed, but also to provide the elderly an opportunity to talk to somebody. We've got a mental health issue here of people who we think need to be isolated for their own protection or the protection of others, and yet we can't afford the elderly to become depressed because social isolation in the elderly is a problem anyway. So the notion that individuals would be available to you at this time of great stress, who can help at many, many different levels, whether it's helping with food service, whether it's helping with taking temperatures, basic health screening, whether it's helping with talking to the elderly, whatever it might be that keeps your nursing home vibrant, keeps it safe. So we hope that you will be supportive of the CNA program. Keep in mind that our graduates often have been gainfully employed, but perhaps they're employed in the hotel or tourism industry and they've been furloughed. Perhaps they've been employed in manufacturing and there's been a supply chain distribution problem and they haven't been able to go to work. Whatever it might be, you're getting people who are motivated to help at this time of crisis. And if they find their way to your facility, you can be sure that they're motivated to work with the elderly. It'll be our job to train them extremely well in their CNA program. Thank you.